momentarily, but we really appreciate your time for joining us today. We know everyone's schedules are crazy busy, especially with the startup of school and all that that brings. But today's focus really is to educate our community on a federal program that we think is going to be advantageous for our members and really make a difference in terms of some of our fiscal challenges that some of our communities face. And so, you can see on the screen, we've got sort of an agenda of what we'll cover today. We hope to have time at the end for questions as well. This webinar is being recorded, so if you'd like to have this for maybe review later or to perhaps share with others within your teams, we're happy to send the link out to you. So we'll just jump right in. And so I'm Jamaica Williams. I'm the Director of Member Engagement for Merit Network. I've been with the organization for a little over 10 years now. I get the privilege or have the privilege of leading the team of the engagement managers, which are really dispersed and located all throughout Michigan, really living within the regions that they serve. And I'll pass the torch just briefly over to our partners, Martin Maize and Michael Wallace, to briefly introduce themselves. And then I'll just kind of review our agenda. So we'll start with you, Michael.
Well, good morning, good afternoon. I'm Michael Wallace, the University of Arkansas Medical Sciences. I'm the Assistant Director for UAMS's Institute for Digital Health Innovation eLink Consortia. I've been with UAMS about 14 years now, and we've worked with this FCC program for approximately 12 years. Okay. Pass that on to Martin.
Good afternoon, and as Michael said, I'm Martin Maize, and I'm a Senior Project Manager of the UAMS eLink Consortia. I do all kinds of stuff, so and we appreciate the Merit Group for having us for this opportunity to kind of give you some more information on this USAC rural healthcare program.
So thank you both. So just, real quick to review the agenda, we're going to cover, or I'll start us off rather with covering just kind of what this program is, what the Rural Healthcare Connect Fund is, who can participate, who the eligible entities are. I'll give a little bit of history around the partnership with regards to Merit and the UAMS team. And so UAMS, we throw around a lot of acronyms in this space, but that's the University of Arkansas Medical Sciences. I believe I got that right. If not, they'll correct me if I'm wrong. Also, we'll talk about sort of the details of the program and the process, and then I'll pass the torch over to Martin and Michael with UAMS. And then again, hopefully allotting for time at the end for questions. So I think, Martin, you're driving the slides. If you'll go ahead and advance to the next slide. Okay, so I'll just start just briefly. And again, I'm sure Martin or Michael may go into this a little bit further in detail later in the slides. But just at a high level, what is the Rural Healthcare Connect Fund? It's administered by USAC, which is the Universal Services. Oops, go back one. Okay, thanks. So USAC, again, acronyms, is the Universal Services Administrative Company. They administer both the RHC Fund, Rural Healthcare Fund, as well as E-rate. And some of us on the call may be a little more familiar with the E-rate program. Well, you can think of the RHC program as a comparable program to E-rate, but for healthcare entities and or secondary education entities with healthcare teaching programs, just to kind of provide some high-level context. So again, a federal program that offers discounts or reimbursements, I should say, up to 65% for eligible broadband connectivity expenses. And again, we've talked about kind of who. I'll talk a little bit more about that in the next slide. It's funded by the Universal Service Fund, and I'll give you just kind of a little bit of history on USF. It was established in 1934 by the Communications Act, and really just has policies around, helping initially make what used to be telephone service and now broadband service broadly available throughout the United States. There is an eligibility process to take advantage of this program, and so I'll touch on that. And as I mentioned, our partners will probably delve into that a little bit later in the presentation. I do want to say that the funding is requested on an annual basis, so it's not kind of a set it and forget it. It is an annual request and program. And Merit actually has members that have been participating in the RHC program for years, in one way, in one capacity or another. So this is not anything new. Our partnership with the consortia is new. And so we'll kind of talk about what that means. And again, think about this as if comparable to the E-rate program, but for healthcare entities and healthcare teaching entities. Okay, next slide. All right, so who's eligible to participate in the program? By and large, we're talking about nonprofit organizations. So I'll kind of start with that, just kind of as an overarching umbrella. But, as far as healthcare entities are concerned, we're talking about mental health centers, community health centers, or health centers providing healthcare to migrants, local health departments or agencies, not-for-profit hospitals, but also dedicated emergency rooms of rural for-profit hospitals, rural health clinics, skilled nursing facilities, and again, post-secondary education institutions, including tribal, that offer healthcare instruction. So if you have, a teaching hospital or a medical school or a nursing program, allied health program, or basically, any patient care instructional program, you could be an eligible entity, as well as research programs that are focused on patient outcomes. So again, I'm sure the team will maybe, dive into that a little bit later. You can transition to the next slide now. So I'll go just at a high level, talk about the history around how this partnership came to be. So, Merit is always looking to deliver value to our community, to look at industry trends and how we might pass along information that might be of benefit to our community. And that includes, syncing up with the QUILT, which is a national association of all of the research and education networks across the country. Many may not know this, but there are 40 merits, if you will, throughout the entire US. And the QUILT is that national association of all of those RNEs. So the QUILT also enables us to pass along various discounts on a host of pre-vetted and RFP services, such as licensing and our VMware program as an example. But they often will hold and host conversations around what some of our other RNE partners are doing that's providing value to their community. So over a year ago, I attended a session whereby the Arkansas Research and Education Network, referred to as ARON, was presenting in partnership with the UAMS eLink team. And they talked about this consortia that enabled so many of their members to take advantage of these RHC reimbursements or discounts and the difference that it made within their community. And so again, the RHC program isn't new. It's something, like I said, that many Merit members have been leveraging for quite some time. But this consortial arrangement was new to Merit in terms of how ARON was partnering with UAMS. And so it was really intriguing. So we began to, explore and really have conversations with the UAMS team. We talked to the ARON team more. The UAMS team is partnered with other RNEs besides Arkansas, such as I believe the RNE in Louisiana, the RNE in Florida. So the conversations really started to evolve, and Merit began to explore how this could be of benefit to our community. So we kind of, did a pilot year one, which was last year, and worked with, several Merit members, 4 of which included governing members. bringing them into this consortia, getting them eligible in partnership with the UAMS team, and submitting funding requests. So this year, we're looking to expand beyond just kind of that pilot year, if you will, to all of the merit community. Now that we've learned some things, we've really, I think, fortified that partnership with the UAMS eLink team. And so again, looking to expand this year. So again, RHC isn't new. And in fact, an individual entity, a healthcare entity, a rural healthcare entity, could pursue RHC funding independently. I'll just say that. But there is a difference when you are partnered or when you when you fall under the umbrella of a consortia. So I'll just kind of touch on a little bit of the consortia difference. And again, this may be detailed out a little bit more later. So first and foremost, the program is called the Rural Healthcare Program. So there's that issue of rurality. Well, when you're under a consortia, as long as the entire consortia maintains 51% or more rurality, then individual entities within the consortia don't necessarily have to all be rural. So urban locations can be included. So that's number one in terms of the consortia difference. Number two, there is expanded service in terms of eligible services that can be filed for reimbursement when you fall under a consortia. Number three is the role of the consortia leader. So UAMS eLink, in this case, they are the consortia leader. And they play a very broad and beneficial role in terms of what they do for the members of the consortia. And I won't go into it in great detail, but they really almost play, and I'll toot your horn for you, but they almost play, you know, the role of really doing the heavy lifting on behalf of the member, and they are the experts, so you don't have to be. So that's huge. And then finally, to participate in the RHC program, it typically requires competitive bidding, and that's a whole process. But because of how merit is structured in terms of our governance, our bylaws, and how we bid upstream services, that prevents the need for members to have to go through that competitive bidding process when they're participating in this way. And so again, won't steal too much of Michael and Martin's thunder, but I just kind of wanted to talk about the consortia difference in case folks are wondering, well, why can't I do this on my own? You absolutely can, but there are major benefits for working under or going through a consortia. And so I think that's the last slide that I have. Yeah, I think that's the last slide that I have. And so I will actually pass the torch over to Martin and Michael to pick it up from here.
Well, I appreciate you, Jamaica. Any questions? Jamaica's done it all. She said it all. And there may be some redundant information from what Jamaica stated, but she's absolutely correct on everything that she stated as it related to eligibility types or entity types, if you will, that are potentially eligible. I always use the term potential as it relates to the eligibility as well as the funding, because until you get that confirmation from USAC, until that check is in the mail, it's potential for you. So I use that term potential. But as she stated, we are the UAMS eLink Consortium, the University of Arkansas for Medical Sciences. We're a teaching hospital, full service hospital, if you will, Trauma One hospital in the state of Arkansas. And we're also a teaching facility as well that has several external clinics and offices related to our university. We're housed, if you will, in sorts under the College of Medicine, but we're the Institute for Digital Health and Innovation. We became an institute, I would say, about 4 or 5 years ago, institute within our own section here. And our group, the eLink Network, the eLink Consortia, we're housed within that Institute for Digital Health. eLink, and this is just a brief on what eLink is and what we do. We're actually a dedicated healthcare network We have pretty much all the hospitals in our state on our network in some form or fashion, the ERs. We have telemedicine equipment in most of these hospitals and some clinics in the state of Arkansas that we manage along with our full service IT video support group that's 24/7, 365 available to our eLink members. We develop an RFP every 3 years, and maybe sometimes in between those 3 years for certain necessary reasons. But in general, we do an RFP that we request services from vendors in and out of our state for all of our state consortium members. And we do that for that lowest cost pricing in our state for some wide area networks, some dedicated internet, SIP circuits, things of that nature, as well as negotiate prices on network equipment for these connectivities as well. And of course, as Jamaica stated, and probably the reason that you're all here is we are one of the largest USAC rural healthcare consortia in the country, and we're the consortium leader for that particular program. Again, just to go into the eLink network, and this may not be the most updated, but we have over 750 endpoints that we manage within our network. As I said, we have that full service IT video support group that manages these endpoints throughout the state. They're all HIPAA compliant, and again, have 24/7 access every day of the year for these particular services, these endpoints. We have within our department a lot of telemedicine programs as well, stroke, trauma, high risk OB, those types of programs that we also support through our Institute for Digital Health and Innovation. So kind of enough, if you will, about us as eLink, if you will, or IDHI, what we call Institute for Digital Health. But what we're here for is to kind of talk about the USAC Rural Healthcare Fund. And as Jamaica so eloquently stated, it is an opportunity to get a 65% reimbursement on your eligible services. We say eligible services because there are some level of services that are not USAC eligible, anything from this rural healthcare program. Now, if you're looking at anything that's landline telephones, any computer equipment in general, those types of things are not USAC eligible for this rural healthcare program. But what we're looking at are your services and fees associated with your merit membership. And some of these slides are really kind of giving more of a detail on the eLink consortia and the eLink group as it relates to some of our in-state members as well. For our RFP, and this is general information, for the RFP that we put out every 3 years, we have upwards to 58-60% off list price for some of these items that vendors provide for broadband services, equipment, the connectivity itself, if you will. We negotiate those lowest costs so we can make sure the member is getting a full benefit of our negotiated price with that vendor for our in-state members. And it keeps that cost at a fixed cost for every 3 years, so that vendor can increase that particular cost until maybe that next negotiation time within that RFP. We're currently in the process, the heavy lifting side of putting together an RFP that will be for fiscal year July 1, 25 through June 30th of 28. So we're getting all of our documentation in order from our legal department, and pretty soon we'll be submitting those documents to USAC and start our actual evaluation process and bidding process with that particular RFP. This slide here just kind of depicts some of the dollars that we've been successful in retrieving for a lot of the higher eds in all those states that Jamaica listed. When we first started in around 2014, Michael Wallace has actually spearheaded this endeavor and found this program and did a lot of research on what was needed. How do we implement this as a university? Because we kind of checked all the boxes, if you will, to start a consortia. And that very first year, we were fortunate to get funds that Mike was able to hand a check for almost $240,000 to our leadership at UAMS. So from 2014, we kind of expanded what we were able to do with this USAC rural healthcare program. And if you see over here, highlighted in green on this USAC 65%, this represents the dollars, total dollars that we were able to turn back over to higher ed, such as yourself, in the state of Arkansas, the state of Kansas, as well as currently we're working with Louisiana, of course, Michigan, Florida, and one net in Oklahoma. We have other states that we're in conversation with on the ground stage, if you will, trying to get some of those members deemed eligible. Just as a point of reference for your benefit, our pilot group with merit, and this is, we did several of the governing members, that's what you call them, the governing members, as well as a separate funding request for some affiliate members that wanted to take part in this pilot. And what we're looking to turn back is about $2.8 million back to those merit members appropriately if we get this funding request approved. So it's potential dollars right now, but once we get that funding request approved, and at the end of the fiscal year, which will be June 30th of 25, we'll have the opportunity to request that disbursement of those funds, and those monies will go back into those higher eds appropriately. And the monies that are returned from USAC, that 65% reimbursement, it's not earmarked for your broadband connectivity. It's not earmarked for your health ed program. You can utilize those funds in-house as you see fit. We have many of higher ed, such as yourself, that like to use that money and tell that vendor to use that as a credit toward their next year's services. So you'll be out of pocket less money each year. Even if you do a credit amount of that reimbursement back to your vendor, we still have that opportunity to submit for funding, support your full merit services for that fiscal year. So this is done fiscal year at a time. Jamaica also discussed the entity types that are potentially eligible for this USAC program. And again, what's probably more relevant to you are the universities and community colleges. This program was originally, if you will, geared toward those healthcare facilities. They call them HCP, healthcare providers, but it's also open to the health education providers as well. You know, the thought is if you don't train your health educators, you won't have any to be caregivers at your healthcare facility. So those, and we say health education providers, your health education program has to be an accredited health education program. So, you know, your LSME, if that's the accrediting body for your College of Medicine, or your accrediting body for your College of Nursing or thereabouts, if your program is accredited, we have an opportunity to utilize that program and that facility that your program is located as your USAC eligible entity, if you will. We'll kind of talk a little bit more about the eligibility process as well. And this slide right here just kind of corresponds with the filing cycle as it relates to USAC. I talked about that RFP that we do each 3 years. July 1st was our first opportunity, our first day that we have that we can submit our RFP process, if you will. But we have up until technically until that filing window closes. But for your purpose, what we look for once we can get your site deemed eligible for this program, we would submit a funding request. It's called Process 462, if you will. We have an opportunity to submit that beginning December 1 of this year. This would be for your merit, services, and fees associated with July 1 of 25 through June 30th of 26. So we ask for the money in advance, or ask for the support of that reimbursement in advance. Sometimes there before or right after that fiscal year starts, we'll get an approval of that or denial, but 99.9% of the times we get an approval of that request sometime after the fiscal year starts. After services have been completely rendered, because we'll generally submit Research and Education Network members as an annual cost, because that's generally how that vendor submits your billing, if you will, and this is across the board. We'll submit it as an annual cost. So at the end of that annual year, which will be June 30th each year, and to this specific purpose, June 30th of 26, somewhere thereabouts, we have an opportunity to request that disbursement of those funds that were awarded. You generally have 180 days at the close of that fiscal year to actually request that disbursement. If you don't request that disbursement within that 180-day period, or you don't get an approved extension to that deadline, money is gone. So we work fast and furious with that vendor to get all the supporting documents that we need to show that your bill was paid, because this is a reimbursement program and it's not a grant. With it being a reimbursement program, we have to show that you effectively paid that bill. Once we can show that you effectively paid that bill for that fiscal year, you can get that 65% reimbursement. 99.9% of the time, again, we never have an issue with this invoice filing date. There are some one-offs where we may have to request an extension, but for the most part, we try to get this part ramped up within July, no later than August of that end of that fiscal year, if you will. When we say the path to cost savings, we're just kind of showing you some of this is not a full list, if you will, but it's some of the highlights of the things, the items, the services that are eligible for USAC support. Again, I talked about wide area networks. We talked about some SIP services. If your campus utilizes that for your voice over IP, your data center, of course, a data center and an offsite admin center standalone are not USAC eligible, but they do become eligible if they support an eligible location. So most of the time, if not, your connectivity for a college campus will come in through a data center. It's generally not that point-to-point directly to your health ed building. So what we would always ask you to do, and I may be speaking forward, but what we would always ask you to do is get that data center that your connectivity comes in, get that data center deemed eligible, if you will, so we can have a flow of showing, hey, this isn't the actual eligible location, but this data center is needed and required to disperse that connectivity to that eligible location, which would be your health ed building. Now I'll get a little more specific about that as well. And probably going back through, Michael probably have something to add, if you will, on some of these eligibility types as well. So when we talk about your eligibility, each entity, each location, physical location, address, city, state, has to be deemed eligible on its own. So your health ed building, where you on your campus would consider to be your quote unquote, your main location for your nursing program, for your College of Medicine, for your allied health, College of Allied Health, those things, city, address, city and state of those buildings, it technically would not be the entire campus that we would be looking for. We would drill down to that health ed location. Reason being, USAC is physical address specific to what they deem eligible as a location. Now, what we found and what we've been audited for this exact purpose, but what we found is that the way a higher ed, a college is structured, as I said before, you generally don't have your connectivity go directly into a building. It passes through a data center. But that same data center that supports your College of Nursing, that supports your College of Medicine, may also support your library, may support your gym, may support your fine arts building. Those particular locations, your gym, library, fine arts building, may not be USAC eligible. But because that connectivity passes through that data center for that College of Nursing, College of Medicine, we don't have to itemize that connectivity, if you will, and say, hey, 10% supports this building, 15% supports this building. All we have to do is show that DMARC and show that it does support your eligible locations. Now, there's some one-offs and some extended benefits, if you will, if you're structured like our university. You know, we have primary data center. We're a large university, if you will, and a large campus. Primary data center, secondary data center. So those two data centers support up to 100, I would imagine, of buildings and locations on and off this actual campus. We have to go through, if you will, and get each and every physical location that could be potentially eligible for this program. We go through and get those buildings deemed eligible for USAC eligibility. The reason being, we have several vendors from our RFP that provide those connectivities to those non-health ed buildings, but those buildings are related to the health ed program. So we have our College of Medicine location. It's listed at 4301 West Markham in Little Rock. That is the actual USAC eligible location. But we have students from that College of Medicine that rotate, train in certain clinics that's away from this 4301 West Markham. So we have maybe a VA hospital or a orthopedic clinic, if you will, that's off the campus that we would actually get deemed eligible as a part of this health ed program, because that actual location is utilized for residency, for training, for clinicals for that student. We have to do that physical location on its own and get that location approved. So we have to show the association of the program to that building, to that clinic, to be able to get that clinic deemed eligible as part of this health ed process of it. The clinic alone, being in a rural area, would not be a USAC eligible entity on its own. Again, because it is in a rural area, because it is in an urban area. So we have to utilize the health ed side of it to be able to get that location deemed eligible. So that's some of the strategy that we use on our campus to be able to facilitate a lot of the external locations. And as D'Amica also stated, that's actually one of the biggest benefits of a consortia is that rurality piece. A lot of your entities may otherwise qualify. You may be public, or you can be public or not for profit. You don't have to be both, but generally for the state colleges, they're public institutions. But if you're a private institution, but you're a not-for-profit that still could potentially have you a part of this particular program. You have to have that accredited health ed program. And in theory, you would need to be a rural entity. But again, if you are a part of a majority rural consortia and you otherwise qualify, you can still participate under a consortia only. So the eligibility process generally takes between 30 and 45 days. What we would do is have you complete a document. It's called it's a paper document, but the process is called 460. That's the eligibility process. And it just asks for some demographic information on your actual parent organization, if you will, and as well as that actual eligible location that we're looking for, that college of, that allied health program, that physical location, address, city, state. If you're like our entity, we're University of Arkansas Medical Sciences, but we're under a UA system, if you will. So if you're under a system, that will probably be your parent org, but your eligible entity would be where you consider to be your main address for that health ed program. We would ask you to provide us your accreditation documentation. It doesn't have to be the full book of the accreditation. It can really just be a screenshot from that accrediting body, show us that URL that we can point the reviewer back to show that your program is actively accredited. We need something that validates that tax status, that says that you are a public or a not-for-profit entity. And we would also need something to validate that physical address that we're listing. Again, USAC as a physical address will only allow one eligible entity at that physical address. So if you have multiple health ed programs that reside under one building, we wouldn't submit your College of Nursing and your College of Medicine if they're both listed at 123 South Main. We would just ask you to pick one and we could utilize that program for that physical location. Once we get those documentations, we send those off to USAC along with what we don't call it actually, but what's called a letter of agency. It's a document that we give you a template of with all USAC required language, if you will. And it states that your entity is giving our consortia, the E-Link Consortium, the ability and the authority to be able to submit these documents on your behalf. These will be documents related to that eligibility process, related to that funding request process, as well as related to that disbursement request process. There's also a process listed on there. It's called a 461, which is the competitive bid process. For this group, that would be not relevant to you because we can bypass that competitive bid process, and I'll tell you why in a second. But we leave that language in that document because we do utilize this document for all of our members, that even that 461, that competitive bid process may be relevant. So within that document, we have you place that on your letterhead. You sign and date it, or have someone that has signatory authority on your campus sign and date that document. And we submit that to USAC. You must be deemed eligible before you can be presented on a funding request. That has to happen. Now, the actual funding request, generally we work with the vendor, which this would be Merit, to kind of fine-tooth comb any services that they're charging you for that may be potentially USAC eligible. So we've kind of done that already with Merit, but there could be some one-offs that you may have, some opt-in type of service with Merit that may be potentially USAC eligible. We would then work with Merit to provide the documentation for us as we present those documentation. What we would do once we get you deemed eligible, after that filing window opens December 1 or thereabouts, we would submit all Merit members that are eligible and are participating in this program on one funding request. And as I said, this just by Merit's choice, we did a funding request for governing members and a separate one for affiliate members. So if your services and fees for that fiscal year amounted to $100,000, we would submit that 100,000 for eligible services. We would submit that $100,000 to USAC for support. If and when they approve that funding request, you have the opportunity to receive $65,000 of that back to you at the end of the fiscal year. So that's the request for funding. The disbursement request, and if you have questions, please, I'm trying to go fast because I'm looking at the clock just to make sure, in interest of time here. After we get you deemed eligible, after we submit that funding request, after USAC approves that funding request, at the end of that fiscal, we have an opportunity to submit that request for disbursement, Form 463. Again, we do this as a bulk with all the merit members that are eligible and are participating. We get the verification documentation from the merit group to show that each member individually has paid their portion of their invoice. Once we can prove and show that that member has paid, we submit those documentations to USAC. They review all the documentation and they can disperse that 65%. The 65% that dispersed goes directly to the service provider, which would be Merit. So our consortia, Elite Consortia, does not see that 65% in no way, form, or fashion. It goes to the service provider, then the service provider returns the amount appropriately to each member. Now, our organization, we have a process as well. For this process and for members, we charge a fee. Charge a 10% fee of whatever your cost savings amount is for that funding request. We do this for our program sustainability, for the administrative side of the things that we do for you. As Jamaica said, we do all the heavy lifting for you. We provide all the documentation to USAC. We deal with any request for information. What that is if we submit something, they say, hey, this isn't clear, we need to know this, and we have this information that we need. We deal with that as well. If and when we're audited, we initiate and orchestrate that audit as well. There may be an opportunity that we have to reach out to individual members, excuse me, or the service provider in relation to an audit to get any kind of verification documentation. But we go through that audit with that team, which is generally a third-party CPA firm. Most of the time, USAC hires an outside firm to do these audits. So we work with that firm to get these audits done. And over the past 10 years, we've been audited multiple times. I want to knock on wood because we hadn't been audited in a couple of years, but there were some very outstanding things that happened, and I'll let Michael talk to it. That I'm 1,000% sure we'll get audited on, but it's going to be a great audit. And so for that fee as well, we charge you 10%. So in that $100,000 example that I gave you, if your services and fees are $100,000 for that fiscal year, and that's how much we submit for your support, and USAC approves it, and you're allowed to get that $65,000 back, we charge you 10% of that $65,000, which in that example would be $6,500. We do these funding requests as well as our side of the process each year. Your eligibility, once you're deemed eligible, you're eligible for the duration of the program, unless you have a change within your eligibility requirements. If your health ed program loses accreditation, if you're purchased by another entity that's now a for-profit entity, if you just actually physically move from the location that we have you listed as, those would be some of the only reasons that we would have to submit you for eligibility. Otherwise, once you're eligible for the duration of the program. And again, we do submit funding requests each year. So that is a yearly process. 99% of the time within that process, we generally work with the service providers. So you generally don't see or hear from our consortia again until it's either that time for us to either submit you an invoice for that 10% or if you have any questions that we need to answer for you or help guide you through. For our process of that 10%, we'll engage with an agreement with your entity specifically. So this agreement is not a USAC function. It's not a merit function. It's us engaging into an agreement with your entity to say, hey, we agree to allow you to invoice us for this 10% each year. We do that every 5 years for our members. Coming on at this time, we would submit you for eligibility. And when it's time for us to engage in that agreement with you, which we generally do that new agreements closer to the time of the end of the fiscal year. The current agreements, as well as that letter of agency that I talked about, they currently expire June 30th of 26. So you won't have a full 5 years in this cycle. But after June 30th of 26, when we update those letters of agencies and the E-Link agreements, those will be good for a full 5 years, will be to June 30th of 2031. And that sounds a little crazy to say 2031, but we're almost there in the 2030s. So we're moving here. You don't get a reimbursement. We don't ask you for 10%. So that's a good thing to do. Going through the eligibility process is kind of a no charge, if you will. We're doing that in good faith in hopes that we can get you deemed eligible for this particular program. And after that, and we submit you on a funding request, and we know that we have an approval of that funding request, and we're set to the time to submit for that disbursement request. That's when we'll initially engage with you with that agreement, as well as what we call an order form, which is in essence a quote. It just shows the amount that we submitted on your behalf and what that 10% fee cost would be for you. This is if you want to take a picture of this slide, or I'm unsure Jamaica will provide these to you, but this is Michael's contact as well as my contact. If you have any individual questions, we're free to be able to speak to anyone. We can set up a 30-minute time to speak to you individually. We can do other group sessions if you like, but we're available here for any questions that you may have for this particular program. Again, it's not something that you have to have and get done so quick that we're not here and able to help you. We're here to talk you through whatever questions that you have, whatever questions that your legal team has with some of these documentations, because they're going to have some questions. We run into that each time with new members. But going back to that slide showing the numbers, it is tried and tested that this program is effective. And we've been successful with returning over $60 million over the last 10 plus years to these higher eds that go back into your budgets. And I can open up for questions, or Michael, if you have something burning that you'd like to add as well, please, by all means, sir.
Well, let's just open it back up for questions. I see the one in the chat about firewalls. Your USAC eligible network equipment, services, warranties, things like that are initially dependent, that's not a good way of saying it, are dependent upon the USAC eligible connectivity. Typically, your first year, your connectivity provided by merit or merit membership is what we would use to demonstrate that you have a supported USAC piece of connectivity. Once that's done, then you can look at the A and Z end of that piece of connectivity for equipment refresh, for warranties, for professional services. Martin had the demonstration or had the numbers up there. Last year in 23, we did a UAMS refresh of both the primary and secondary data centers at $6 million. That $6 million covered About 700,000 professional services. It covered licensing, it covered warranty, and the warranty was set up for expensed out at 5 years. It was Cisco equipment as an example. So that was a $6 million capital expense. Monday, this week, we received $3.9 million back. So UAMS received a cash ACH deposit Monday. So it does work. There is considerable effort and work involved in something like that. It works well if you plan. But your very first thing you have to understand is you've got to have that merit membership deemed eligible. And that merit membership has to show the circuits associated with it. And then from there, you can go after other opportunities, either on your campus or within your primary, secondary data centers if you have that. So that's it. We do have, and I can provide you some specifics on some of the allowable USAC expenses. So if you'll put a couple of those in the chat. I see one that says fiber bills for connectivity. That's possible. I wouldn't know how to answer that without knowing the specifics. And there is a lot of due diligence in um, equipment refresh that we have to go through.
And forgive me as I was going through, I didn't see the chat because I guess was sharing my screen, but I'm looking at the questions, and it seems that Michael and Jamaica answered many of these. One in particular that I see about vendors that you have other than Merit.
Mm-hmm.
At this junction, we can only submit for merit, services, and fees. And here's the reason why. Did you want to go ahead and say that, Wallace?
Yeah, hang
Okay,
on
go ahead.
just a moment. Initially, your first cycle is all about merit membership, merit connectivity. In conversations that Jamaica and I have had, there is a program, My Deal, Michigan procurement, and Jamaica has started to get me oriented to looking at that, doing the research on it. So it may be possible that you could buy from different vendors off of My Deal and have that submitted. It again, it's all predicated on the connectivity established through merit membership initially. So that's what you need to keep in mind. So if you have other vendors, and I see one about cybersecurity, I've submitted $600,000 before for Rubric. If you know that technology, it was funded. We submitted a 1.5 million for
Rocky.
no, this one was like a CrowdStrike product that actually are on the State Research Education Network, like Merit, submitted. Okay. Yes, ma'am.
Jamaica.
Yeah, so I kind of wanted to answer that with maybe just an overarching statement.
Mhm.
So as Michael and Martin have stated, year one, it's about your connectivity and getting that approved. And then subsequent years, we can take a look at, and I think that I believe I received a private question about equipment. In subsequent years, we can take a look at additional services that may be eligible, right?
Mm-hmm.
Now, there are some caveats to that, which is why you keep hearing us say may be eligible. One of the caveats is you can't, or the rule states that these purchases have to be made through either a government master services agreement or a master services agreement, which is why you hear Michael reference My Deal. That is one of the requirements. In
Yes.
addition to the service being eligible, it also has to be procured in a certain fashion. So with Merit, we're operating as a master services agreement for your connectivity, which is why that's an eligible service allowed under the RHC, prevents the need from having to go out to bid. But the additional services fall under that same kind of requirement. So that's why we're not able to just say yes or no on a specific service. It's not, is it an eligible service and how was it acquired?
Mm-hmm.
So what
Very good.
Merit is looking to do, is try to make this as broad and advantageous of a value to our members as possible. So we're now, yes, we know we've got the connectivity, we can check that box, year one. But year two, how do we continue to expand this so that our members can take advantage of those eligible services through a means that allows them to receive that reimbursement? And that's what we're having those conversations now, because yes, we want you all to be able to take advantage of equipment and cybersecurity, all of those services I think that Martin showed on that slide that are possible. We're looking into that now to see, okay, what can Merit do, or what vehicles exist today that our members might be able to leverage to also submit in their funding request with their connectivity, with their Merit connectivity, so that it's maybe like a bundle request as an example that's eligible. So we are certainly looking into that and exploring that. But I kind of wanted to just answer that question with just an overarching statement. It's not just whether or not the service is eligible, it's also how it's obtained.
Mm-hmm.
And you have to keep in mind, in order to have the benefit, as we said before, in order to have the benefit of that equipment piece, that equipment has to directly support that connectivity that USAC has already supported. And that is a major piece. They will not support equipment that is not directly associated with supported connectivity. They will not support anything that they deem to be inside wiring as well. So any of those types of things would not be USAC eligible. I saw another question in chat as well. Someone stated that they have this done by another company. How hard will it be to move to UAMS? Not hard at all. All we have to do is, oh, that's like 12 o'clock. Sorry, excuse me. All we have to do first is have that letter of agency. If you've already been deemed eligible, that means your entity already has an HCP number for that health ed program. If that is the entity that is already being submitted for support, all we would need is an active letter of agency adding you to our consortium. Now you have the right and ability to be in multiple consortiums under the USAC RHC. The thing is, you cannot double dip, if you will. You can't get support for the same service twice. And so we would definitely make sure with Merit, and we would have to get some information from you as the individual entity to validate that we're not submitting for the same service twice. I think we could probably verify with Merit that they're not providing this information as the service provider for a third party, if you will. So that'll be a good check and balance. But that is the biggest thing that USAC would look at. Again, we would have to have that active letter of agency for you, and we could then start submitting for your Merit services and fees. So it's not hard at all. It's just making sure that we have that letter of agency for you, and that when we get to the submission side of it, that we're not submitting for something that you're already receiving support for. Yes, ma'am, Jamaica.
So I just wanted to ensure that we answered one of the questions. I think we started down the path, but possibly didn't finish answering the question with regards to if one of my locations is being served not by Merit. So I think, Martin, you began to answer that question. So just to reiterate, the funding requests that the consortia leader, UAMS, is filing is on behalf of Merit being the service provider. So if you have other locations, you won't be able to bring those under these funding requests because Merit is not the service provider for those locations. So I just wanted
That's
to
accurate.
just put
Absolutely.
respond to that.
Here's the flow. You have to have an eligible entity. You have to have eligible connectivity, and you have to have an eligible service provider. So each and every service provider, although they may provide what is needed for USAC, they have to be distinguished as a service provider. And as Jamaica said, that service has to be procured in a certain fashion in order to be considered USAC eligible. And so it's, I use the term easier. It's easier for us to utilize merit on your behalf because of what's already in place. And that need for our consortia to construct an RFP for you is not on the table because what merit already has in place. If you have an AT&T circuit or something as a redundant circuit, that may be something that you can look at getting possibly redundancy from merit. If that's something that merit provides, that way that connectivity as well can be considered for USAC support. So it's a strategy that can be used within this program, and along with the things that merit provides, if they provide that for you, that you can bundle or couple those costs in to what we submit for support.
And I'll remind us, so again, when we were talking earlier in the presentation about kind of this partnership difference and the consortia difference. So the RHC program exists, and for most participants, they have to go through a formal RFP or bidding process. They have to file forms for that. They award that. They file funding requests. They file reimbursement requests. They do a lot of that either on their own or in partnership with a consultant. We are doing that. We're just doing it a lot differently and with a much lighter lift on you, the community member. Well, there are some prerequisites to be able to do that. One is operating under a consortia. And secondly, it's operating under a master service agreement or a government master service agreement. And that's where merit comes in. As Martin was mentioning, we are an eligible service provider operating with a master service agreement or a government master service agreement because of how we're structured, because we are a research and education network, because we are governed by the public universities within Michigan, because we do go out to bid for upstream services on behalf of all of our community members. And so because of that, the members within this partnership, within this consortia, don't have to go out to bid. You can just participate in the consortia and they file those forms on your behalf. They do all of that heavy lifting for you. So I hope that kind of sheds a little bit more light on the question of, is it just my merit connections? Can it be my other connections? This is why it's just the merit connections. Hopefully that is a little more enlightening.
Everything Jamaica said.
Everything Jamaica said.
Yeah. We're going
Not that we think that we're so
steal Jamaica now.
All of that has to be in place. Yeah.
There's a lot of possibilities. It's all defined by each of your institutions and your relationship with merit. And there's a lot to consider, the details, but essentially the very first thing you want to think about is submitting the letter of agency and allowing us to submit your location or locations for eligibility determination. And that right there tells you that's something that USAC determines. We don't do that. But from those eligibility determinations, that in turn is where we can come back to merit and say, these institutions were deemed eligible, whatever their membership is, however you want to package a funding request. And again, you have between now and probably toward the middle of November, first part of December, to package up the eligibility documentation, get us to submit it. You have between the 1st of December and probably first, second week of March 25 for us to help merit package a funding request for any potential institutions. So that's your timeline.
I was trying to answer that last question about the fiber bills. About the fiber bills.
Oh, the fiber build. Yeah, it's interesting because in some cases in Arkansas, I'm sorry, um, Aron's membership will include a fiber build for a new circuit location. So it depends on how you work with Merit to institute that build out. And Martin brought up you have resilient or redundant circuits. Merit could provide it through a last mile provider, two different, but it's under the Merit membership, which makes that um, eligible.
I want to kind of bring that point home. I had that as a topic. So we provide, your primary connection, but just to reiterate what Michael was just saying, we can provide a resilient secondary connection. As long as it's a completely separate
Hmm.
connection, you can also file for reimbursement for that connection. Merit can be that provider, or we could, have a different last mile provider, which as many of you know, we wrap that all into one solution. So you're just interfacing with Merit. So it's maybe over someone else's assets, but RHC will allow for a secondary connection, a primary connection and a secondary connection. And you can have the same provider provide both of those
Hmm.
as long as they are truly separate. So from a resiliency perspective, for those who need that added level of uptime, you can take advantage of the RHC program for that.
Yeah, here's a good example too. Um, on UAMS's campus, we have primary and secondary data centers. Well, there's Aron, the equivalency of Merit, provides diverse path 100 gig circuits into campus for Internet 2 as an example. Um, we have redundant diverse paths for SIP circuits. There are 4 circuits in place. Um, one of them alone is $29,000 a month, and that's established through RFP pricing. So that was the best price we could get. Those are covered, and that's those SIP circuits that support voice, video, data, telemedicine. But they're again 2 different vendors through our RFP, but that could be something similar in nature through uh, what Merit provides or the My Deal. I don't know that. I'm still researching the My Deal. That was a very interesting conversation Jamaica and I had.
Another question that the team here thought might be good to perhaps clarify is, and I'm not sure if you all can answer this question, but what constitutes rural versus urban? Do you all know what that
Hmm.
count is? Can you talk about that just briefly?
Sure.
Y-
You know,
Yeah, go ahead, Wallace. Well, generally, is it 22, 25,000?
25,000 in population.
25 in
It has to
population,
be
and
removed from a SMA, standard metropolitan area.
mhm.
We have had a very rural hospital in an adjoining county, separated by the Arkansas River, but it was in proximity 5 miles to a town that had 28,000 in population. And it took me probably 2 years to get that resolved.
Mhm.
But once it did, then that small hospital got their USAC benefits.
And then again, keep in mind, uh, don't concentrate so hard on the rurality piece because
Hmm.
we will,
We
as a
got that covered.
consortia, we will maintain that over 51% rural, which brings me to this a point I was going to state. The letter of this program is not to just dish out funds, if you will, but it talks also about larger organizations with more resources being able
Hmm.
to help benefit smaller entities, more urban areas being able to help the more rural areas that has less resources. That's what this whole program, the letter of this program is about. And with that being said, at some point, we would reach out our consortia. We have people on our team that would reach out to you and or your health ed program to just kind of do some discovery and see how that program works with your clinics in your area or hospitals in your area. Is there some joint venture where students can get jobs immediately, or if those community health centers in the area that has little to no resources, can your setup be part of a resource, even if it's just an informational resource? So we look at that full spectrum as well, because we know the University of Michigan's or the Michigan States are these big entities, but you have these smaller groups, hospitals, community centers, and things like that around those areas that may have less resources, less information, less knowledge, if you will, of broadband, of actual connectivity and things that go with it, that we try to pair a couple people with those that are considered the experts, and that may not have that financial resource to hire a managed service group or something of sort, and can get certain information internally. So we look at a full spectrum of the program itself for the dollars, as well as the letter of what this USAC program, the gap that they're trying to alleviate, if you will, with the larger and the smaller, the urbans with the rural. So everybody can have good quality broadband connectivity and have access to the correct information that they need for their connectivity security, for telemedicine programs that are in use, and things of that nature. So we do a full spectrum of things, and those would be things that we engage with your programs individually. And again, this is not a merit thing that we do, because we try to do this across the board with all of the higher eds. You're in a unique place. If we're doing a comparison with our group, our colleges put out several nurses and doctors each year that go to these smaller towns to train, to do their residency, to do their clinicals. And it benefits those smaller towns who would not have some of the specialists, have that telemedicine program accessible, if it were not for our program, our telemedicine program. So we're trying to help bridge those gaps as well as getting you that funding that you can help put back into your budgets and do something awesome with.
And speaking of funding, I did want to just kind of give an update for those who are on the call that already participate in the program. And Michael and Martin, correct me if I'm wrong, but we expect sometime this fall to have some updates on the funding decisions. We've already received information requests that we've responded to, so we know that they're currently under review, which is a positive sign. But maybe perhaps between September, November timeframe, we expect to hopefully hear something relative to the funding requests that were submitted for fiscal year 7/1 of 24 through 6/30 of 25. So just wanted to provide that update.
She is correct. And those that did participate in this current cycle, try not to overthink about waiting on that approval of that funding request as we're looking at this next year's cycle as well. I think we did a good job on that information request. Hadn't heard anything else back, as Jamaica said, and what sometimes could be a good sign is that they're moving it to what they're called final review stage. So hopefully in the next month, maybe two, that we will have a positive outcome that we can share and give that tried and tested result for you, that if you're having any type of hindrance on being a part of the program, we can say, hey, we're going to get this group back 65% coming up after June of 25. So we're here to help, as I said, and we're here to engage in conversation. When you need to, we can get you on a schedule, 30 minutes, 45 minutes to kind of talk about certain things. If all your players are not on the call, that would be relevant to you making some form of decision as well.
And then one final thought relative to additional eligible services. So for those members who are subscribed to services beyond connectivity, such as Mirror Managed Firewall or DDoS, those services, once we get the connectivity established in year 1, year 2 and beyond, those services are eligible to be bundled in a funding request. So if you have those today or don't have those today and want to take advantage of those in the future, you could potentially receive up to a 65% discount on those additional security services as well, because Merit currently provides those today. So again, you know, I'll see one last time if we have any additional questions. While I thank the UAMS team and all of those who attended today, we hope that this was informative and beneficial. If you'd like to know more about the program, please don't hesitate to reach out to your engagement manager. We're here, as Martin and Michael said. I'm about to combine their names, Michael, Martin. As they've said, we're happy to, you know, get on the phone and just talk a little bit more in depth about maybe your unique situation, your needs, your questions or concerns. Because, you know, again, this is about adding value, additional value to you, our community members, in this way. So with that, I'll wrap us up. And again, thank you all. Thanks everyone for attending. Have a good afternoon.
Great day, everyone.
Thank you.